Assalamualaikum warahmatullahi wabarakatuh. My name is Naufar Isri binti Abdul Jalil, and I am here today to explain about the abstract of our article review on workplace violence in Malaysia healthcare industry. Workplace violence is one of the many issues that arise nowadays and need to be addressed immediately. Several studies have reported that this issue shows significant increased rate over the years, with different factors included. Therefore, this article review is conducted to analyze the issue of workplace violence in Malaysia healthcare industry that was studied within 10 articles with different authors' perspectives. This issue is worth reviewing as it will provide knowledge in understanding better about workplace violence in Malaysia healthcare industry. It is due to the fact that the healthcare facilities were intended to provide a safe and conducive atmosphere for patients as well as employees, but it was compromised by workplace violence. Our findings indicates that the prevalence of workplace violence among healthcare workers, where nurses had a slightly higher prevalence than doctors with 34.2% and 21.8% for doctors. In addition to that, the most common forms of workplace violence were physical violence, followed by psychological violence, while the predators of it were occupation, workplace setting, and working hours. Hence, the reason for this review is to understand better about workplace violence in the Malaysia healthcare industry, analyzing the types, forms, impacts of workplace violence towards workers in healthcare industry, and highlighting the joint efforts in giving preventive measures against workplace violence in Malaysia's healthcare industry. Next is introduction. Workplace violence is crucial and has increased in the global phenomenon today, including Malaysia. The definition of workplace violence, based on the overall article by the Occupational Safety and Health Administration (OSHA), is any incident or attack, assault, harassment, terrorizing, and other threatening destructive behavior that takes place at work, and are divided into two broad categories, which are physical, that includes punching, beating, kicking, pushing, slapping, stabbing, and shooting, and psychological violence, where the intention to harm that person's or group's physiological, intellectual, spiritual, moral, or social development. Compared to employees in other professions, healthcare professionals are more likely to experience workplace violence. Statistics recorded by Sahiran and others, 2022, that the percentage were 88.9% was psychological violence and 2.5% of it was physical violence. Rajakrishnan and others stated that among healthcare industry workers, nurses were the most affected by workplace violence with 34.2%, followed by doctors with 31.8%, and the remaining of it were other healthcare professions. This issue raises concern as workplace violence could affect healthcare workers' health, and they are more prone to show symptoms of post-traumatic stress disorder (PTSD), reduced self-esteem, burnout, and other physical and psychological problems that might be harmful to them. Workplace violence has become a crucial safety and health concern given the risk it brings to workers, the workplace, and also the society. Therefore, in these studies, the authors wanted to clarify the factors, types, forms, impacts, and solutions of workplace violence that happen in the Malaysia's healthcare industry. And now I will pass to the next presenter.
Assalamualaikum, my name is Muhammad Adam Aiman bin Ma'rifin. So, I will explain the objective for this article review. There are 5 objectives why we are doing this review, which the first one is to understand better about workplace violence in Malaysia healthcare industry. The second one is to determine the factors and reason of why workplace violence happen in Malaysia healthcare industry. The third one is to analyze what are the form of workplace violence. The first one is to analyze the impact of workplace violence toward the employees of healthcare industry in Malaysia. And the last one is to identify what steps should be taken to reduce workplace violence in Malaysia healthcare industry. Next from me is identification issues from the articles. In the first article, which by Sahiran LL 2022, they have conducted a study to evaluate the prevalence of workplace violence and its factor among medical workers in emergency departments. And they found out that the percentage of workplace violence is 38% among 231 respondents. The second article by Raja Krishnan LL 2022, they have found that the workers being violent is 68.5% among their 838 respondents. Muhammad Anwar and Nick Muhammad 2022 also have distributed questionnaire to study incident, effect, coping reaction and action taken towards violence received by pre-hospital care staff in Malaysia, and they found that the prevalence of the violent incident was 56.3% for the past 12 months. In the article by May 2022, they intend to identify the risk factor and the impacts of workplace violence in healthcare settings, and they found that it will eroding the peace and stability of the engaged communities and endangering the health and welfare of the populace. In the article by Rustam and Habibin 2021, they mentioned that roughly 75% of the 25,000 workplace assault cases reported in healthcare and services each year. Next, in the article by Ahmad et al. 2021, they state that workplace violence in emergency department was reported by 93.6% among 63 respondents. In the article by Samsudin et al. 2021, they also found that prevalence of workplace bullying among the participants was 13% in the 6 months. Safwan and Arifin 2020 has conducted a study to identify the predictive factors for workplace violence, and they mentioned that 1 in 4 workers had to deal with workplace violence in the previous 6 months among 481 workers. After that, in the article by Halim et al. 2018, they found that consciousness was one of the dimensions of the 5-P model which lead to workplace bullying. And lastly, in the article by Zainal et al. 2018, they state that the prevalence of reported workplace violence was 71.3% among 136 respondents. So, to conclude the articles above, it shown that workplace violence cases was highly happen in healthcare sector. So, that's all from me. Now, I will pass to next presenter.
Assalamualaikum to Dr. Syamsul Anas Kasim. My name is Balkis binti Abdul Samad. Today, I would like to present about issues, discussion and analysis of workplace violence in Malaysia healthcare industry for 10 article reviews. Saira ETL 2022 discussed about 4 factors that cause workplace violence among healthcare workers in the emergency department in Malacca General Hospital, Alor Gajah Hospital and Jasin Hospital. They used questionnaire method to collect written data, where the data will be analyzed in multiple logistic regression. Furthermore, Safwan and Arifin 2020 discussed about 5 causes of workplace violence that occurred towards healthcare workers in Selangor Health District. The methods used to collect the data were stratified random sampling, face-to-face interview, and structured questionnaire. The data were analyzed with software package for social science version 22.0 and in terms of univariate logistic regression analysis. In addition, Ahmad ETL 2021 discussed about the factors of workplace violence that happened towards emergency residents in Hospital Sungai Buloh, Selangor. The methods used for the issue discussion were questionnaire-based and self-administered cross-sectional survey. Software package for social science SPSS version 16.0 was used for data analysis, and even chi-square was used to know the relationship between the independent and dependent variables. Moreover, Raja Krishnan ETL 2022 discussed about the causes of workplace violence that occurred towards government primary healthcare workers in 9 districts in Selangor. The data collected by sampling, self-administered questionnaire, and ethical approval, where all the data were analyzed in IBM SPSS Statistics version 24 and chi-square to get descriptive statistics of the issue discussion. In other respects, Muhammad Anwar and Ning Muhammad 2022 discussed about the influences of workplace violence among pre-hospital care personnel in 3 main hospitals in Klang Valley. The methods used for the discussions were multi-centered cross-sectional survey and questionnaire. The data were analyzed in Statistical Package for Social Science SPSS Statistics for Windows version 26.0, where the data will be in terms of frequency and percentage. Likewise, Subsidiary ETL 2021 discussed about the causes of one type of workplace violence, which was workplace bullying that occurred towards junior doctors in 12 government hospitals with horsemanship training within the central zone of Malaysia. The methods used to collect relevant data were sampling, the negative X questionnaire revised, and survey. Analysis data was made by software for statistics and data science versions 14.0 and the data analyzed in terms of logistic regression. Moreover, Muhammad Halim ETL 2018 discussed about the influence of personality that led to one of the workplace violence elements, which was workplace bullying that happened among female nurses in Kuala Lumpur Hospital. The related data collected with methods of cross-sectional survey, certified random sampling, and questionnaire. The analysis data expressed in terms of means, standard deviations, and zero-order correlations under descriptive and correlation analysis, and which were analyzed by the structural equation modeling. In addition, Rustam and Habibie in 2021 discussed about the factors of workplace violence that happened among healthcare workers in Ministry of Health Malaysia. It did not have specific methodology and analysis for the issue discussion, as it was conceptual paper. Furthermore, Zaina ETL 2018 discussed about the causes of workplace violence among nurses and doctors in Kuala Lumpur Hospital. The methods used for the issue discussion were sampling and questionnaire. The data analyzed by IBM SPSS Statistics version 22 and in terms of multiple logistic regression. In addition, May ETL 2022 discussed about the factors of workplace violence in Malaysia healthcare settings. The methodology and analysis that had not done in this issue discussion, as it was conceptual paper. On top of everything, psychological violence, verbal abuse, physical violence, sexual harassment, and perpetrator of violence were the most frequent factors that happened towards Malaysia healthcare workers. Besides, the methodology of sampling, questionnaire, and survey were the most used in the articles. Moreover, the articles used a variety of analysis to analyze data such as multiple logistic regression, univariate logistic regressions, and software package for social science in many versions, except for Rustam and Habibie 2021 and May ETL 2022, as they were conceptual papers. I think that is all from me. Thank you.
Hi, Assalamualaikum. I'm Ahmad Najmi bin Nurhan and my method number is 202-111-0343. To recap, or to summarize for conclusion, 3 authors highlighted or emphasized that workplace violence was undeniably present and it's difficult to deal with. According to Sahiran 2022, regular competency training on the identification, notification, and management of workplace violence for hospital staff may indeed promote best practices. Workplace bullying and was a significant predictor to depression personality, or depression. As a result, it was critical to emphasize that personality should not be overlooked in order to understand employees' vulnerability to workplace bullying. Furthermore, being upright was linked to being subjected to workplace bullying, which influenced depression indirectly. According to some 2021, those in the younger age group working in secondary hospital and also working in the emergency department had a higher likelihood of experiencing workplace violence. This would have an effect on their mental health and could lead to long-term depression. Finally, this author wants all the parties involved to resolve the issue using proper method and procedure by providing training and guidelines. Other than that, four authors agree that Ministry of Health (MOH) should develop some work-life balance policies and practices in order to improve retention, attraction, and motivation among Malaysian healthcare professionals. Also, future studies must be conducted using prospective design, simultaneously evaluating individual types of violence and their potential risk factors. Or, special attention should be given to organizational workplace characteristics that may increase the risk of violence. For the other two articles, the two authors agree that health education and intervention should target those at risk in order to reduce the occurrence of workplace violence and its negative impact on individual organizations. For recommendation part, all the 10 articles had different view or perspective about the recommendation. For Article 1, a road with Sahiran 2022, we recommended that prevention such as education programs regarding workplace violence among healthcare workers should be done, particularly focusing on the younger age of group. Second article, F1 2020 said in his article that notification system specifically on workplace violence incidents should be strengthened to capture all incidents in detail. For the third article, Ahmad 2021, he only recommended one thing, which was to emphasize educational approach on the stress and violence to communities and all levels of hospital staff. The next article, Rajakrishnan 2022 recommended to primary intervention should focus on improving safety climate factors and prevention strategies, which focuses more on the coping with violence and integrated approach encompassing individual and organizational level strategies. Next article, Muhammad Anwar 2022 recommended that developing system for advanced warning for potentially violent patients in liaison with police and law enforcers and ability to restrain or defend oneself from abuse. Next, Samsudin 2021 also recommended one thing, which is recommended that a proposed strategy should be developed. Next, Muhammad Alim 2018 recommended that personality should not be neglected to understand employee vulnerability to bullying at work, and organizational characteristics should be put along with personality factors as antecedents when investigating bullying at work. For the third last article, Rustam and Habibin recommended to MOH Ministry of Health to launch guidelines for preventing and addressing violence against members, which raise awareness and produce a prevention violence training module. For the second article, Zainal 2018 said that Rome intervention strategies like providing training to improve coping skills in dealing with workplace violence. And for the last article, written by May in 2022, recommended that management of each healthcare setting need to create, adapt, and establish a practical, acceptable, and sustainable workplace violence prevention program. That's all from us. Thank you.